As already stated, there are many misconceptions about HIV, AIDS, STIs, and sexual health in general. What follows are all examples of actual fallacies volunteers have heard. Though some seem outlandish, it is important we meet people where they are information-wise and realize that without the formal sexual education we were privileged enough to have in the U.S. public education system, many of us would believe these misconceptions too. First, some STI, HIV, and AIDS misconceptions. Misconception number 1. HIV and AIDS are spread through coughing, close contact, use of public toilets, showers, hammams, touching someone with the virus, insects, sharing food, water, silverware, kissing or hugging, or through razors. Though some STIs, such as herpes, are potentially transmitted through kissing when an outbreak is occurring, and sharing a razor with a person infected with some STIs can potentially spread the STI, none of the aforementioned circumstances spread HIV or AIDS. To dispel this myth, reiterate that HIV and AIDS are spread exclusively through sex, needles, breast milk, and birth. It is only spread through infected liquid, blood, semen, vaginal discharge, breast milk, entering an open wound or orifice. Misconception 2. STIs occur from either sex or the cold. Bird. People believe that some STIs are caused by the cold striking genitals or by sexual intercourse, and that either way you will know when you have an STI because it will always cause genital discharge. We have to be aware with misconceptions like this one, it gives STIs more than one form of transmission, one that is particularly less hashuma. People have invariably decreased the social stigma of STIs by doing this, but it's inaccurate. Accordingly, we have to be careful about dispelling this misconception. We have to say that, according to scientists, STIs are only spread through contact with an outbreak or through blood, semen, breast milk, vaginal discharge of a person with the illness. Misconception number 3. STIs are an issue with women. Men are, quote, victimized by women, in that women intentionally give STIs to men, especially prostitutes. To dispel this misconception, explain that transmission is equally possible from male to female, male to male, and female to male. You can also bring up the statistics on genders that were affected by different STIs. As you recall, we looked at it all before. It was the report from the Moroccan Ministry of Health. It showed that more men than women actually have STIs. While all that's true, you should also feel free to explain that sex workers, both male and female, are much more likely to have an STI in Morocco, and that the only protection from the STI would be to not have sex with sex workers, or if they did, to have a condom. While all this is true, STIs are absolutely a woman's issue, in that consequences of STIs are more severe for women than for men. Socially, their stigmatization is arguably harsher. Men also have greater access to treatment for both social and economic reasons. Misconception number 4. Sex with a virgin cures AIDS. This is an extremely scary misconception. To dispel it, again, let science do the work. Reiterate that unfortunately there is absolutely no cure for AIDS. That being said, there are drugs available, the antiretroviral drugs we discussed earlier, to give folks longer, healthier lives. If a person with AIDS has sex with a virgin, all they can possibly do is infect a new person, which is the exact opposite of the goal. Misconception number 5. It only happens to certain groups of people. This is along the lines of STIs being thought of as a punishment. This is a much harder concept to dispel. If someone believes Allah is punishing people for having sex before marriage, you can of course explain that STIs are still passed on after marriage. If people believe STIs are punishment for having sex young, you can explain that STIs can be passed on to a person of any age. If people believe STIs are punishment for sex, period, we can explain that they're transmitted in other ways, like through needles or breast milk. All we can do is explain that Allah may have a plan, but we should take the steps to protect ourselves from suffering while Allah is still giving us time here. Misconception number 6. HIV can pass through latex. Wrong, alhamdulillah, it can't. That's why condoms are so important. Please reiterate that this does not mean that condoms are foolproof. They break and they don't protect from all types of STIs such as herpes, but when used properly, they can protect against HIV and AIDS transmission. Misconception number 7. If you smell good, you cannot get infected. Any misconception that says, if you do this thing, you cannot get infected is incorrect for the same reasons. Infections come from risky sex, breast milk, needles, unsterilized blood transfusions, and birth. That's it. Nothing else has any bearing on whether or not a person gets infected. Misconception 8. Everyone dies of HIV. With antiretroviral treatments, the effects of HIV can potentially be small, giving a person with HIV a full, long life. But in order for them to work to their utmost potential, they have to be started early after infection. So
Created using Powtoon.